How does a large private company obtain the COVID vaccine for their employees?
Well, it's not easy right now because there's a significant challenge with access to the vaccine. So the first step is to immediately apply with the state that your site is in to register that you want to have a on-site COVID vaccination clinic at your facility. And when you do that, you have to attach a provider to that application. So you've had to chosen a provider and put their information down there. And then it's quite granular, the questions. There's quite a few questions, technical questions about actually getting down to the point of storage, how you're going to store the vaccine, what kind of refrigerator you're going to use. So it's very technical and very time consuming, and there's multiple stages of the application that you have to go through.
That sounds like a lot of work for a large company that's in many states. Can a private company hire IHP to do the application process?
Yes, absolutely. And we've done that for over 100 sites so far around the United States and over 30 states. In addition to going through the registration process, it's also helpful to facilitate, IHP can do this as well, is facilitate a relationship between our client and the local public health officials, such as the county health officials, who are typically the folks that are actually going to have the vaccine in their hands from the state, and then they can dispense it. So we reach out to the local public health officials, whether it's a county or the city, and say, hey, our client at the site is interested, has an intention to have a vaccination clinic, and we'd like to make you aware of that, and we want to work with you to facilitate that.
Once an application is in place, what happens next?
Well, first of all, we started doing, just to give you an idea, we started doing applications for our clients back in November, and many of them have not been completed yet. So that's why it's so important to start early. However, one of the reasons that they haven't been completed is there just hasn't been access to the vaccine for most employers because they're still vaccinating healthcare providers and people over the age of 75, long-term care facilities. So they haven't even really put any attention, the state and the local health officials, on the employers. Now, the first employers that are going to get the vaccine are going to be the employers that are truly essential workers, like the utility companies, the food storage companies, the food distribution companies, anything involving basic needs that the society requires.
And what's included with InHouse Physicians vaccine program?
Well, in addition to what I just mentioned, which is probably one of the biggest things that we can help an employer with, is consulting on how to get access to the vaccine. In addition to that, we receive the vaccine, we can store the vaccine, we can do the scheduling of your employees to come get the vaccine. We administer the vaccine, we do the monitoring, which is required about 15 minutes after you administer the vaccine. You have to monitor the recipients of the vaccine to make sure there's no adverse effects. And finally, the reporting back to the government officials. That's required now to report who got vaccinated.
Can companies mandate their employees to be vaccinated?
That's a great question. And Thomas, I'm not an attorney, so all I can tell you is that what I'm hearing is that there's a possibility that you can. But again, I'm not a lawyer. What I'm also hearing is that if employers are allowed to do that, they're probably going to have to follow other regulations that give employees an option to opt out of it with some type of alternative way to work, such as continuing to work remotely.
Once an employee gets vaccinated, is the second shot guaranteed?
Absolutely not. Yeah. So right now, there's already issues with, we have healthcare providers that are getting their first dose, and then 3 weeks later for Pfizer and 4 weeks for Moderna, they need to get their second dose. And they're already having problems getting their second dose in a timely fashion.
And how do you think the rollout of the vaccines will look in the coming months?
Well, I think the biggest theme that we're seeing right now is challenge to access, right? So people are not able to get the vaccine in their phase. Right now we're in 1A, 1B, 1C, and that's due to two reasons. One, there's just a shortage of vaccines. Second, there's a distribution issue. So we're having issues, even though states have access to the vaccine, they're having an issue distributing it. The first challenge, which is the shortage of vaccine, I think that will improve as we get other vaccines approved. The J&J vaccine, the AstraZeneca vaccine, that will increase the amount of manufacturers that are making the vaccine. The distribution issues, I think, going to improve as well with the Biden administration's plans. And as they roll them out, I think the biggest initial plan is to get the vaccine into pharmacies, a network of pharmacies. I think 6,500 to start and eventually 40,000. I think that will help a lot. And then there's some other initiatives the feds are doing as well to increase distribution capabilities.